stage 1 of my ACL rehabilitation protocol. By the end of this video, you're going to know everything regarding the acute process coming out of ACL surgery. Today I'll be speaking from a professional perspective as a working registered physiotherapist, but I'm also speaking as a patient since I am coming out of my second ACL surgery, and it's been just short of 2 weeks since my operation. You can literally still see the ecchymosis or the bruise that being cannulated left me. So take it from me, I'm glad I'm not on the endo when I'm recording this video, but I do know what endo feels like, I do know what tramadol feels like, I do know what it feels like to wake up in the recovery ward without the surreal experience of gross instability in your knee. So in this video, we are going to be talking about the acute recovery following ACL reconstruction, whatever ACL reconstruction it is. I'm going to compartmentalize this video a bit with timestamps so you can always jump to whichever segment is most relevant to you. But the segments will be first, goals, second, guidelines and considerations regarding the acute recovery phase. Third is contraindications and precautions, and fourth is exercises and the associated rationale with each exercise. The goals of stage 1 is directly related to recovering from surgery. So goal number 1 is to achieve primary wound healing across the 4 incisions that are placed in your knee for the ACL reconstruction. You might have 5 if you opt for the 5th lateral loop tenodesis, but typically ACL recon candidates will only have 4 incisions. The main 4 are one right over the pes anterine where they harvest the hamstring tendon. Then you have the anterior medial camera hole. You have the anterior lateral portal, which is where they go in to tie the suture. And then you have a 4th hole right around the vastus lateralis where the pilot drill comes out of, and that's to pull the ACL into place. Now, the second goal of stage 1 is literally minimizing swelling, because surgery is literally incising the knee, going past gracilis to harvest your semitendinosus tendon, which is your hamstring ACL graft. You will sustain damage in the local area in that hamstring, pulling down into your ankle. Therefore, you want to encourage the process of inflammation, but also decrease swelling pressure to gradually increase your range of motion. And finally, for the third goal of this stage, it is to ideally restore as much range of motion as you can. Just to clarify here, there is no perfect generalization of when you should regain extension or flexion, to what degree, at what time. I myself personally have been on both ends of the spectrum, so after my first surgery, it took me 1.5 to 2 months to regain full flexion and 1 month to get to 0 degrees full extension. But now, with my most recent procedure, just being short of 2 weeks, I'm now hitting 95 degrees flexion and I'm pretty much at 0 degrees near full extension. To put this into perspective, I've had patients that were stuck at the 60 to 70 flexion range till about 2 months, and they were still walking with a limp at around 3 to 4 months, which is generally the stage where people are jogging or running in a straight line. So the key idea is, while restoring range is a key goal, don't compare yourself to blanket statements or blanket generalizations. Everyone is different in their recovery and how fast they recover. Every leg is also different coming out of ACL reconstruction. Now the next chapter is guidelines and considerations. So the first thing that we're going to consider is decreasing swelling and pain with RISA, rest ice elevation and referral co-contractions / static isometrics, muscle pump. All of those will decrease swelling. But bear in mind that swelling may persist beyond 6 weeks. So if that's you, or if you know someone that has persistent swelling, that's still part of the natural recovery process. The second thing to keep in mind is weight bearer as tolerated when you're day 1 post-op. So what you want to do is attempt to walk as pain tolerates. Try your best to walk without a limp, although a limp may persist up until 3 months. Also bear in mind that when you do walk, or when you go upstairs, or when you go downstairs, initially most people will actually toe strike, and that's because the ankle is now compensating for the lack of knee extension and knee flexion. As inflammatory hydraulics and swelling pressure decreases, you'll gradually find yourself heel striking again, and that's because you've regained your knee extension and flexion. Following surgery, you want to wean off crutches as soon as you can. So every surgeon is different. Some prefer to come off day 1 post-op, some prefer 2 weeks post-op. Those are just the experiences that I've had myself. Just know that the rule of thumb is that you want to get off crutches because it can influence your normal gait patterns and how you walk normally. Now, the fourth consideration is to increase range as pain tolerates. Coming out of surgery, we know it's going to be painful. It better be painful. It has to be painful. There's no way that coming out of surgery, being bashed up in your leg, doesn't result in pain. It will hurt to move into flexion, it will hurt to move into extension, but pain upon extension and flexion is a sign of a tight and intact graft. An unpainful knee post-op is indicative of graft failure or graft loosening. So keep those things in mind, bear through the pain and gradually get more range. Number 5 is wean off medication by 2 weeks. And yeah, I know how endo feels. It kind of feels good. I know how tramadol feels, where you just take it and you want to sit all day long. Try and wean off medication by 2 weeks. If you need to take more, then go see your GP or go see the surgeon for more medication. But medication is just a crutch for you to do exercises. Make sure you don't become dependent on the medication because that's going to stunt your recovery. Consideration 6 is going to your first follow-up appointment post-op, which is roughly around 10 to 14 days. Now, if you are seeing an old school, kind of old style surgeon who is still using undissolvable stitches, he will be taking out your stitches then, which is relatively pain-free considering the fact that you've just had surgery. Now, if you go to a surgeon nowadays, most surgeons are using dissolvable stitches, so it's just there to check your Lockman's test, make sure that the graft is intact and you're good to go. Now, surgeons may also put in a note that by this stage at around 10 to 14 days, because that wound has essentially sealed up, you can potentially go swimming. Now, this is different depending on each surgeon's opinion, but at least with my most recent surgeon, personally, he gave me clearance to go swimming and go walking in the pool for hydrotherapy and proprioceptive work inside the pool. The last consideration that you want to take into account is using an abduction pillow and or a pillow to elevate your legs. It could be anything, could be a pillow, could be a folded up blanket, can be whatever you make it out to be. So there are 2 reasons why you want to do this. One is for draining of your inflammation when you are immobile, and the second reason is if you were to sleep on your side or roll around, there is something to support your knee without introducing ligament creep, which is when the ligament deforms or elongates, which could lead to graft loosening. Now we come to the 3rd chapter of this video, which is precautions and contraindications. So the first precaution is to make sure you don't start exercises too late. You want to start exercises day 1 post-op. A lot of people tend to hit the ground running, wanting to increase flexion as well, but also keep in mind that extension is very important too, and that is to reduce risk of capsulitis, significant graft tightening, and excessive scarring. The second precaution is tubie grip. Now, tubie grip is a bit of a debated area. Some surgeons will advocate for full sleeve tubie grip for 2 weeks, which is coming from your ankle all the way up to your groin area, and others will recommend against tubie grip because it poses DVT risk. I won't have too much of an opinion on tubie grip other than following a surgeon's protocol. I myself had to wear 1 full sleeve the first time when I did my right ACL, and then now that I'm doing my left ACL, I didn't have to wear any tubie grip at all. Personally, I don't think you need the mechanical advantages of tubie grip to decrease inflammation when you have the pharmacological effects of Mobic or meloxicam and you're taking those consistently after surgery. The third precaution is no open chain exercises. Now, Josh, a lot of people ask me, what are open chain exercises? Open chain exercises are basically exercises where your limb is free moving, unlike closed chain exercises, which is like a squat or a deadlift, where your leg is planted on the ground. For example, an open chain exercise would be knee extensions, or for example, hamstring curls on the hamstring curl machine. Now, we don't want to do open chain exercises because it places excessive tension on your ligament, so that poses arthrokinetic risk, which can lead to graft loosening or graft rupture. Bear in mind that open chain exercises are done when there is better union of the graft, which occurs at 6 to 8 weeks. But again, the caveat is that hard open chain exercises can still disrupt the graft. To put this into perspective, full graft maturity does occur at 3 years time. So when the 3 years time crosses over, then you can start getting into really heavy open chain exercises if you plan to do so. The next precaution is not to do isolated hamstring strengthening or hamstring stretching for at least 6 to 8 weeks. Now, this is again another debated area and it's contingent on your surgeon. So I would do what your surgeon prescribes. Some surgeons, like my first one, told me to stick to this rule. Some other surgeons, like my most recent one, advocated for day one very light hamstring stretching. The fifth precaution is regarding continuous passive motion, CPM. If you've used the machine, you'll probably know what it is. And this can be used for the first 30 days, usually used in America and Taiwan for a patella tendon autograft. So this is a machine that essentially cycles your leg through its range of motion as if you're on a seated bicycle. And the rationale is that as you're going through motion, you are draining residual fluid in your leg through articulation, and you're also increasing mobility. Finally, Australia isn't that big on CPM machines because it's expensive and it's actually as efficient as just walking around and actively performing your exercises. But again, it's a viable choice nonetheless. Finally, the last warning is to contact your surgeon within the first 1 or 2 weeks if the following things happen, or any of the following things happen. And those are increased swelling in your thigh or calf or thigh pain, changing color or temperature in your operated leg, gross numbness, fever, excessive vomiting or nausea from pain medication, usually endone, and the last one is continuous drainage or bleeding in your leg. If any of those things happen, definitely call your surgeon. Now we come to stage 4 of this video, which is exercising and the associated rationale behind exercising. Now keep in mind that I have recorded and I will be uploading each exercise individually with voiceover onto this channel. So if your therapist wants to set up a playlist for you, he can always take these resources, put them into a compact place and send them over to you. Or if you are viewing for your own recreational use, you can always take these videos again, take these resources, put them into a playlist and watch them at your own leisure. Now, the first exercise is quad sets with and without a towel underneath your leg. As you come out of surgery, it's going to be hard to initiate your quads due to inflammation. You'll initially achieve flickers of muscle engagement in your VMOs or your inner quad bulk, and then increasingly see your muscle bulge as inflammation simmers. You then want to do prone hangs and passive knee extensions, which are literally static postures that can increase knee extension. After that, you want to try your best to skip to 4-point gait as soon as you can, because that's going to be most identical to walking normally. You then want to practice this probably before surgery, so then you can hit the ground running post-op and you can ditch the crutches as fast as you can. The next thing you want to practice is weight bear shifts post-op. So that's side to side, translating your weight side to side and translating your weight forwards and backwards in a lunge position. Weight bear shifts will be a great way to introduce proprioception early on, and your ACL is meant to be a fiber that is rich of proprioceptive cells. The next thing that you want to do is ankle pumps for inflammation, and you also want to do heel slides to encourage for knee flexion as pain tolerates. You can always use a towel to pull your knee backwards and to give yourself assistance, or you can always lie on your tummy and do active assisted knee flexion in prone. You then want to do your quad hamstring co-contractions at various degrees. So I like to do mine at 0, 30 and 45, even 90 and 60. And doing these isometrics at different degrees is going to lead to better recruitment of your hamstrings and your quads, which are slowly waking up after surgery. Another exercise that's going to be on my list is straight leg raises. Now I'm only putting this here because some surgeons recommend for this exercise. I personally, as a working physio, would shy away from this because it is technically still an open chain exercise. But I have seen people incorporate into their program straight leg raises with and without VMO bias. The next thing that you should do in your acute recovery stage is passive patellar mobilizations in near extension. So that's sitting down with your knee in near extension and wiggling your patella side to side. This is just going to create a bit of movement for the inflammation that accumulates behind your kneecap. To come back to proprioception and balance and introducing balance to your leg, to your ACL graft, you can also do single leg starts, starting off on a hard surface, progressing to a foam surface, and also starting with your eyes open, progressing to eyes closed. You then want to do sit to stands on a elevated surface, so that's doing inner range squats, progressing to full squats or squats to 90 degrees. Coming out of surgery, it's good to have your head screwed on, and it's good to make sure that you are easing into these exercises. So surgeons will recommend against just doing a billion squats day one post-op or a billion lunges day one post-op. Things to keep in mind is that you're working towards doing these exercises. So inner range squats and inner range lunges for you. You can also do wall squats or isometric wall holds at various degrees of knee flexion, whatever flexion suits you. It should start off as relatively easy at the start. You then want to do glute bridges, which is great for glute activation and very, very, very mild hamstring activation. Finally, the second last exercise that you should keep in mind is very, very, very gentle foam rolling your quads and your hamstrings, or even using a tennis ball to roll out your quads and your hamstrings very gently. Depending on where you've taken your graft, make sure you're very conservative when you do this exercise. And the last one is sitting on a Swiss ball, rocking forwards and backwards, and potentially rotating your knees as well. Very, very, very mildly, just to create a bit of valgus varus movement, but also keeping things nice and linear for your knee. To reiterate my point again, it's not ideal to hit all of these exercises straight out of bed, just waking up in the recovery room and busting out 100 squats. It is a work in progress in the whole acute recovery stage. So if you do have an ACL tear yourself, these are just a scaffold for you to keep in mind what's to come in the first period of recovery from your ACL. And I would highly recommend going to a physio in person to get prescribed these exercises in an orderly manner. So that's the end of the first stage of ACL recovery. Now I've only covered the acute recovery stage following ACL reconstruction. I'm glad that you didn't take any endone to bear through the pain of this video. If you found this video helpful, please like and subscribe to this channel for more content like this. You're also getting the resources that you're going to go through your rehabilitative journey. If you yourself have an ACL reconstruction lined up, or if you're coming out of ACL reconstruction, I honestly wish you all the best for your rehab journey. Even me myself, we're gonna get through this together. We are going to smash our face into ACL rehab and then potentially rehab our face later. And do us all a favor by asking all your ACL reconstruction friends, do you even rehab?